Many men ask me, Dr. Emma, why isn't my erection as strong as it used to be? The truth is, erection quality is not just a physical issue. It is the result of a complex interaction between vascular function, hormone balance, and psychological stress. Today, we're not talking about quick fixes or myths. We're talking about science and how you can use a medical perspective to rebuild confidence and performance from the ground up. Once we confirm that your physiological system is functioning properly, we can move into activation training. The goal here is not force, it is not intensity, it is controlled vascular conditioning. The first technique is what we call a gentle sway approach. The principle is simple: microcirculatory stimulation through rhythmic movement. In a relaxed standing position, with your core stable and body relaxed, you maintain a very light circular grip around the base of the glands. The movement should be soft and controlled, using the wrist as the pivot point. The motion is small and rhythmic, similar to a pendulum. The goal is not forceful stimulation. The goal is to create gentle pressure variation within the erectile tissue, encouraging vascular responsiveness. If any discomfort occurs, the intensity is too high and should be reduced immediately. This is a consistency-based training method, not a strength-based one. Vascular activation massage, circulatory conditioning technique. The second method is a structured vascular activation approach. A water-based lubricant should be used to minimize friction. Using a light ring grip, the movement progresses slowly from the base toward the tip, followed by gentle circular motions in both directions. The key principle is controlled pressure with elastic response. You should feel mild tissue responsiveness, not pain. At the same time, deep diaphragmatic breathing is essential. Inhale slowly while imagining increased blood flow and oxygen delivery. Exhale fully while relaxing the pelvic floor muscles. This combination of breath and touch helps shift the nervous system into a parasympathetic state, which is essential for erection quality. With consistent practice, many patients report improved morning erections and better spontaneous response. Let's talk about the driving analogy. Many men experience a single negative sexual experience and begin to label themselves as not performing well. From that moment, anxiety builds. They stop enjoying the experience and start monitoring it instead. This creates a loop. Stress leads to reduced erection quality. Reduced erection quality increases anxiety. Anxiety further worsens performance. This is known as performance anxiety. One of the most effective solutions is sensate focus training. The goal is simple: shift attention away from performance and return attention to sensation. Instead of asking, "Am I hard enough?" ask, "What am I feeling right now?" Focus on touch, temperature, breathing, and emotional connection. When the brain exits performance mode and returns to sensation mode, the body naturally follows. The state of your erection is often a reflection of how you are managing your body, your stress, and your life. When you improve your physical health, regulate your stress, and learn to relax under pressure, your body responds accordingly. Before starting any kind of training, the first step is proper evaluation. Many men, when they experience erection difficulties, immediately turn to supplements or random exercises. But in medicine, that often means missing the real cause. We always start with a precise diagnosis. 1. Vascular function assessment. The first step is evaluating penile blood flow. In clinical practice, we use a penile Doppler ultrasound to measure how well blood enters the erectile tissue and whether there is any venous leakage. Think of it like checking plumbing in a house. If there is a leak or blockage, simply increasing pressure won't solve the problem. 2. Hormonal and metabolic evaluation. We assess testosterone levels, both total and free testosterone. This is your biological fuel. At the same time, we check blood sugar and blood pressure. This is critical because in many cases, erectile dysfunction is actually an early warning sign of diabetes or cardiovascular disease. If the root cause is metabolic or vascular disease, no amount of physical training will be effective until those conditions are addressed. 3. Psychological stress assessment. If all physical markers are normal, we then shift our focus to psychological factors. Ask yourself honestly, have I been under high stress lately? Have I been anxious about performance? Chronic stress activates the sympathetic nervous system, which causes blood vessels to constrict. This is one of the most common reasons men experience erection difficulties despite being physically healthy. And if you want to continue learning structured, science-based strategies for male sexual health and vascular function, make sure to subscribe and turn on notifications. I've also prepared a free 30-minute training program designed to guide you step by step through this process. You can find the link in the description below. Let's start rebuilding your confidence and your performance from today.